Seniors, 4 worst sleeping positions you should never sleep in, and 4 better ones to try. Instead, the profound truth about our sleep positions, often overlooked and underestimated, carries a far greater impact on our aging bodies than many realize, subtly yet powerfully influencing our heart health, cognitive function, and even our capacity for independent living. Unsettling new research from the National Institute on Aging reveals that certain nocturnal postures can escalate the risk of debilitating conditions like stroke, memory loss, and persistent chronic pain by a staggering 60% or more. What remains largely unaddressed is the widespread prevalence of these detrimental sleeping habits among the senior population, who unknowingly engage in them night after night. For millions of older adults, the once natural act of falling asleep has become an arduous struggle, marked by incessant tossing and turning, leading to mornings characterized by profound exhaustion and nagging soreness. The core issue, it turns out, may not solely reside in the duration of sleep, but rather in the very manner in which one sleeps, as scientific consensus now points to sleep position as a critical determinant that can either foster the body's healing processes or steadily contribute to its gradual breakdown. A conscious choice in sleep posture holds the potential to soothe aching joints, safeguard the integrity of the spine, and enhance vital blood flow, or conversely, to inflict the exact opposite effects. Tonight, we embark on a comprehensive exploration of these crucial truths, meticulously examining the 4 most detrimental sleeping positions that should be unequivocally avoided after the age of 60, alongside the 4 superior alternatives capable of replenishing lost energy, sharpening memory, and even cultivating a sensation of renewed youthfulness upon waking. This journey promises discoveries that could fundamentally alter one's approach to sleep forever, providing actionable insights for a healthier tomorrow. Delving into the first category, the most perilous for seniors, we encounter sleeping on your stomach, often termed the face-down position. While it might initially offer a misleading sense of comfort, allowing one to drift off with arms tucked beneath a pillow, seemingly shielded from the world's demands, this position harbors insidious long-term consequences. Many older individuals, mirroring the experience of Mr. Harold, a 72-year-old retired carpenter from Ohio, attest to finding solace in this posture, believing it relaxes their back. However, unbeknownst to them, this transient comfort silently inflicts damage upon the neck, spine, and even compromises respiratory function night after relentless night. Far from harmless, stomach sleeping imposes a silent yet significant strain on some of the body's most delicate and vulnerable areas in seniors. Prolonged hours with the head twisted unnaturally to one side causes severe torsion in neck muscles, impeding crucial blood flow to the brain and compressing sensitive nerves along the spinal column. This persistent misalignment inexorably leads to chronic stiffness, debilitating headaches, episodes of dizziness, and the all-too-familiar pins and needles sensation in hands or arms upon awakening. The American Chiropractic Association emphasizes that this position markedly elevates the risk of cervical misalignment, a condition with grave implications for long-term balance and coordination, rendering it particularly perilous for older adults who are already susceptible to falls. Furthermore, the adverse effects extend beyond musculoskeletal issues. The act of pressing the chest into the mattress severely restricts the full expansion of the lungs, hindering the diaphragm's free movement, and consequently forcing shallow, inefficient breathing throughout the entire sleep cycle. For individuals over 60, this translates to an inadequate supply of oxygen reaching the heart and brain, a deficiency that can exacerbate chronic fatigue, contribute to mental fog, and even precipitate an elevation in blood pressure. Compounding these risks, sleeping face down exerts unnatural and undue pressure on the lower back, a concern that is especially acute for those already contending with spinal arthritis or herniated discs. Dr. Emily Rhodes, a distinguished geriatric sleep specialist, unequivocally identifies this as the most aging position for the spine, explaining that it significantly accelerates the wear and tear on vertebrae, akin to repeatedly bending a tree branch until its structural integrity is irrevocably compromised. Thus, while the stomach sleeping posture may provide momentary coziness, it surreptitiously erodes long-term comfort, one fitful night at a time. The transition to a side sleeping position might seem like a logical alternative to the perils of stomach sleeping, yet even the seemingly natural comfort of curling up on one side conceals its own distinct set of dangers, warranting a closer examination. Moving to the next critical position, we analyze sleeping in a fetal curl with knees drawn tightly to the chest. This posture, often perceived as familiar and almost childlike, is a habitual choice for many older adults who assume a tight, protective ball-like shape at night. Knees tucked closely to the chest and arms held near the body. Mrs. Eleanor, a 68-year-old grandmother from Michigan, maintained this habit throughout her life, describing it as a feeling of safety, as if she were cradling herself to sleep. However, years of waking up with debilitating shortness of breath, pronounced back stiffness, and escalating fatigue eventually prompted her doctor to unveil a startling truth. Her cherished, cozy position was, in fact, subtly suffocating her body night after night. While a tight fetal curl may offer psychological comfort, it imposes significant physical restrictions, particularly on the aging body. The National Sleep Foundation highlights that when the knees are drawn excessively close to the chest, the diaphragm undergoes compression, thereby limiting the lungs' capacity for full expansion. This leads to a reduction in crucial oxygen intake, compelling the body to resort to shallow, rapid breathing patterns. For older adults, whose lungs naturally possess diminished elasticity, this seemingly subtle drop in oxygen saturation can precipitate chronic fatigue, persistent morning headaches, and even place undue strain on the heart. Yet, the dangers of this position extend beyond respiratory compromise. Maintaining a tightly curled posture for prolonged hours forces the spine into an unnatural C shape, leading to the shortening of vital muscles and ligaments responsible for supporting proper posture. Over time, this exacerbates spinal curvature, resulting in a more stooped appearance, reduced stability, and an increased susceptibility to dangerous falls. Dr. Leonard Hayes, a spine specialist boasting over 3 decades of experience, issues a grave warning. For seniors, sleeping too curled up is akin to spending the entire night training your body to shrink. Eleanor's personal narrative serves as a poignant cautionary tale, illustrating how an initial source of comfort gradually devolved into a habit that systematically deprived her of energy and compromised her posture. The fetal curl, though it may initially promise safety, becomes a treacherous trap for aging bodies, insidiously stealing strength, vital breath, and essential balance, night after relentless night. Given the inherent problems with a curled sleeping posture, one might naturally consider lying flat, a position once lauded by many medical professionals for its spinal health benefits, often referred to as the soldier position. However, it harbors unforeseen risks that frequently remain unrecognized by seniors until the consequences become tragically irreversible. The third position under scrutiny is lying flat on your back with no support, or the soldier position. For decades, medical consensus advocated lying flat on the back as the pinnacle of healthy sleep, promising a perfectly straight spine, evenly distributed weight, and optimal alignment. Yet, for the older adult population, this seemingly ideal position presents a far more intricate and potentially hazardous reality. What was once perceived as a stance of discipline and order can in fact subtly transform into a nightly struggle for the health of one's heart, lungs, and even cognitive faculties. Consider the case of Mr. Robert, a 74-year-old veteran from Florida, a proud individual who had adhered to this soldier-like sleep posture throughout his life, lying flat on his back with arms by his side and head barely supported by a pillow. As years progressed, his wife began to observe alarming phenomena, prolonged pauses in his breathing during the night, followed by sudden, loud gasps for air, and mornings where he awoke feeling profoundly exhausted and disoriented. When Robert finally consulted a sleep specialist, the diagnosis delivered a profound shock: severe obstructive sleep apnea. His very sleeping position was, in effect, occluding his airway as frequently as 30 times per hour. When seniors adopt a flat back sleeping position without adequate support for the head and neck, gravity conspires to pull the tongue and other soft tissues backward, critically narrowing the airway. This phenomenon inevitably leads to loud snoring, episodes of choking, and severely disrupted breathing patterns, often occurring without the sleeper's conscious awareness. The American Academy of Sleep Medicine sternly warns that untreated sleep apnea in adults over the age of 60 can elevate the risk of stroke, heart attack, and memory loss by a staggering 60% or more. Furthermore, it causes a dangerous surge in nighttime blood pressure, silently straining the heart as it ceaselessly struggles to obtain sufficient oxygen. But the dangers do not conclude there. Lying flat also significantly exacerbates acid reflux, a prevalent condition affecting nearly half of adults over 65. When the head lies level with the stomach, the protective force of gravity can no longer contain digestive acids, allowing them to creep upwards into the throat, causing painful burning in the esophagus and severely interrupting sleep. Over extended periods, this silent reflux can even inflict damage upon the vocal cords and lungs. For Robert, the critical lifestyle adjustment arrived too late, as years of consistently poor sleep had already exacted a heavy toll, manifesting as chronic fatigue, persistent forgetfulness, and dangerously high blood pressure that proved resistant to treatment. His poignant narrative serves as a stark reminder that apparent stillness can conceal profound danger. If sleeping flat poses such quiet threats to the heart and brain, the increasingly common practice of sleeping in a semi-sitting position, often in a recliner chair, which many seniors champion for its comfort, warrants serious investigation for its potential to undermine bodily health from within. Finally, in this exploration of detrimental sleep practices, we address sleeping in a recliner chair every night. This habit frequently begins innocuously. For many seniors, a recliner initially feels like an invaluable sanctuary, offering a soft, convenient spot to alleviate aching joints, watch television, or enjoy a brief nap. As the discomfort of lying flat in a traditional bed escalates due to persistent back pain, debilitating arthritis, or severe acid reflux, that seemingly benign recliner gradually, almost imperceptibly, transitions into a permanent sleeping arrangement. However, despite the immediate comfort it provides, sleeping in a recliner every night represents one of the most perilous habits older adults can unwittingly adopt. Consider the story of Mrs. Dorothy, a 79-year-old widow residing in Arizona. Following years of agonizing chronic hip pain, she discovered that sleeping in her recliner finally allowed her to achieve a full night's rest. Yet, over time, she began to observe troubling symptoms. Her legs swelled noticeably, her back grew increasingly stiff, and her overall energy steadily diminished. What she failed to realize was that her cherished chair was systematically eroding her long-term health. According to Dr. Michael Turner, a renowned geriatric rehabilitation specialist, maintaining a semi-sitting position in a recliner restricts optimal blood flow to the legs. This circulatory impairment results in fluid retention, leading to visibly swollen ankles, and in more severe instances can precipitate deep vein thrombosis, DVT, potentially life-threatening blood clots that can migrate to the lungs. The partially upright angle of the recliner also prevents the spine from achieving full relaxation, contributing to chronic lower back tension and accelerating muscle weakening in the hips and abdomen over a period of months or years. This muscular degeneration, in turn, critically compromises balance and dramatically increases the risk of debilitating falls. even more alarmingly, because the reclined position inherently limits the crucial deep sleep cycles, the body is deprived of true restoration. One might ostensibly close their eyes for 8 hours, but the brain and muscles remain in a constant state of light rest, never fully attaining the profound healing and memory-forming stages of sleep that are absolutely vital for individuals over 60. Dorothy eventually heeded her doctor's urgent advice and transitioned back to a regular bed after being explicitly warned that prolonged recliner sleeping could significantly curtail her life expectancy. She candidly remarked, "I thought I was resting, but I was slowly shutting down." Having illuminated the dangers of these 4 common sleep pitfalls, the critical question arises: where then lies the optimal position for restorative rest? The answer resides not merely in the choice of bed, but fundamentally in the intelligent positioning of the body. Part 2 now shifts our focus to the 4 superior sleep positions engineered to genuinely heal, rejuvenate, and comprehensively safeguard one's internal well-being. Transitioning from the potentially harmful, we now explore the 4 better sleeping positions for seniors that can genuinely foster healing, restoration, and protection from the inside out. The first of these, the supported side sleep with a pillow between the knees, represents one of the simplest yet most transformative adjustments a senior can make to their nightly routine, profoundly impacting how they rest and greet each new morning. While merely placing a soft pillow gently between the knees while lying on one side may appear unremarkable, its profound benefits for the spine, joints, and cardiovascular system render it an exceptionally potent healing posture. Mr. Allen, a 71-year-old retired firefighter from North Carolina, endured years of waking up with a persistent dull ache in his lower back and hips. Pain medication offered temporary relief, but the stiffness invariably returned. During a routine physical therapy visit, a seemingly straightforward question, "How do you sleep?" unlocked the solution. Allen responded, "On my side, knees together." Acting on his therapist's advice, he began slipping a small pillow between his knees and adjusting his head to align with his spine. Within 2 weeks, his chronic pain had diminished by nearly half, prompting him to declare, "It's like my body finally exhaled." This remarkable improvement is firmly rooted in scientific principles. Research from the Cleveland Clinic underscores that side sleeping, particularly on the left side, significantly enhances blood flow to the heart and effectively mitigates acid reflux by ensuring the stomach remains below the esophagus. The strategic placement of a pillow between the knees ensures pelvic balance, thereby alleviating undue pressure on the lower spine and hips, 2 of the most prevalent areas of discomfort for adults over 60. This simple intervention also minimizes the twisting motions that often contribute to morning stiffness and joint inflammation. Medical professionals aptly refer to this as the alignment saver position, recognizing its natural ability to support the body's natural curves without inducing strain. Moreover, it stands as one of the safest positions for individuals grappling with sleep apnea, as it effectively maintains open airways throughout the night. Mr. Allen's experience is not an isolated incident. Countless seniors have discovered that this modest adjustment can be the decisive factor between waking up feeling utterly drained or invigorated and strong. For those who find prolonged side sleeping challenging, an alternative exists, a position that leverages a gentle incline to shield the back, ease reflux symptoms, and facilitate easier breathing throughout the night. This brings us to the second beneficial posture, the elevated back sleeper with head and knees slightly raised. For many seniors, lying entirely flat on their back can feel uncomfortably rigid. Yet, with a slight, judicious adjustment, a gentle elevation of both the head and knees, this very position transforms into one of the most therapeutic ways to rest and facilitate overnight bodily healing. Physicians term this the elevated back sleeper position, and for older adults, it can be the pivotal difference between restless nights and genuinely restorative sleep. Mrs. Linda, a 73-year-old retired teacher from California, spent years battling severe heartburn and chronic shortness of breath during the night, frequently waking up in coughing fits, her throat burning from the relentless assault of acid reflux. Her cardiologist, Dr. Raymond Cho, proposed a remarkably simple intervention: elevate her upper body by approximately 30 degrees and strategically place a small pillow beneath her knees to induce relaxation in the lower back. The ensuing results were nothing short of life-changing. Within a mere few days, Linda observed a significant improvement in her breathing and found herself capable of sleeping through the entire night without gasping for air or experiencing pain. The underlying science compellingly explains this efficacy. Elevating the head and chest effectively enlists the aid of gravity, preventing stomach acid from migrating upwards and crucially inhibiting airways from collapsing during sleep. According to the American Academy of Sleep Medicine, seniors who consistently sleep with their upper body slightly elevated experience a marked reduction in episodes of snoring and sleep apnea. This, in turn, minimizes the dangerous nighttime oxygen drops that, over time, can exert profound strain on the heart and inflict damage upon delicate brain cells. Concurrently, the gentle elevation of the knees serves to alleviate pressure on the lumbar spine, allowing the supporting muscles to achieve complete relaxation. Dr. Cho frequently imparts this wisdom to his older patients. It's not merely about sleeping longer, it's about sleeping smarter. By adopting the correct angles for your body, you are empowering your heart and lungs to function unimpeded, even as you dream. However, for those seeking a position that not only supports optimal breathing, but also actively rejuvenates joints, shoulders, and even contributes to healthier skin, the next, often overlooked yet powerfully restorative posture, known as the starfish position, might prove to be the missing cornerstone in one's nocturnal regimen. The third highly beneficial sleep position is the starfish position, encompassing back sleeping with arms extended outwards. There is an undeniable tranquility associated with lying flat on one's back, arms gently spread to the sides, palms open, as if the body has finally released the accumulated tensions of the day. This posture is universally recognized as the starfish position, and despite its apparent simplicity, it stands as one of the most profoundly restorative ways for seniors to rest, provided it is executed correctly. In stark contrast to the rigid, flat soldier position, the starfish posture bestows upon the body a liberating sense of freedom. It permits the shoulders to open up, the chest to expand fully, and joints to release the ingrained tension accumulated throughout the day. Consider the case of Miss Linda, a 69-year-old retired nurse from Minnesota. After decades spent on her feet, she suffered from constant, agonizing shoulder aches and frequently awoke with a persistent neck stiffness that would often linger until midday. Her chiropractor, Dr. Raymond Cole, proposed an unconventional yet effective solution: try sleeping like a starfish. This involved relaxing her arms outwards with palms facing upwards, and supporting her head with a specially contoured pillow. Initially skeptical, Linda noticed a significant difference within a mere week. Her neck pain notably eased, her shoulders felt discernibly looser, and she joyfully exclaimed, "For the first time in years, I woke up without feeling my age." The scientific rationale behind this efficacy is clear. When the arms are gently opened and the shoulders are not subjected to compression beneath the body, blood flow significantly improves to the upper spine and the crucial nerves that support the neck and hands. The sleep division at Harvard Medical School confirms that this particular posture can effectively reduce tension headaches and play a vital role in preventing nerve impingement, which is one of the primary causes of numbness and tingling sensations commonly experienced by older adults. Furthermore, the starfish position actively promotes calm, unobstructed breathing. Because the chest remains unconstricted, oxygen circulates freely, which helps to lower nighttime blood pressure and thereby soothe the heart. Dr. Cole affectionately refers to it as nature's reset button for the upper body. Nevertheless, not every individual who sleeps on their back finds sustained comfort in this position. Some may experience a developing ache in their lower back or simply crave additional gentle support. For these seniors, there exists one more profoundly effective position, the ultimate synthesis of comfort, safety, and healing. It is aptly named the 45-degree side recline, and it may very well represent the single healthiest way to sleep after the age of 60. The fourth and perhaps most revolutionary position for seniors is the 45-degree side recline, widely considered the true senior sweet spot. Envision a state of rest perfectly balanced between sitting and sleeping, your upper body gently cradled, your spine in a state of profound relaxation, and your breathing effortlessly deep and regular. This is the essence of the 45-degree side recline, a posture that many geriatric specialists now acclaim as the zenith of senior sleep. It masterfully integrates the finest attributes of both side sleeping and elevated positioning, delivering a combined benefit that is uniquely transformative. For individuals over the age of 60, embracing this specific position can genuinely revolutionize their quality of life. Take, for instance, the inspiring case of Mr. Walter, a 78-year-old former truck driver from North Carolina. For decades, he had grappled with relentless back pain, agonizing acid reflux, and troubling shortness of breath during the night, having exhaustively explored every conceivable remedy, new mattresses, various medications, and even attempting to sleep upright in a recliner, all to no avail. Then, his physical therapist, Dr. Renee Collins, proposed this nuanced, gentle adjustment. Walter carefully positioned himself at a precise 45-degree angle on his left side, ensuring his back was firmly supported by a wedge. A small pillow rested comfortably between his knees, and another strategically placed beneath his head to maintain perfect neck alignment. From the very first night, the difference was palpable. No gasping for air, no burning heartburn, and mercifully, no hip pain. Within a mere week, his sleep tracker conspicuously displayed longer, deeper sleep cycles, and for the first time in years, he awoke with remarkable clarity of mind and completely free from pain. Scientific inquiry robustly corroborates Walter's subjective experience. Research published in the Journal of Geriatric Sleep Studies unequivocally demonstrates that this precise posture can diminish episodes of acid reflux by an astonishing 70%, concurrently keeping airways unobstructed to effectively prevent snoring and sleep apnea. Crucially, it provides optimal support for spinal alignment, a benefit of paramount importance for those contending with chronic conditions such as arthritis or osteoporosis. Furthermore, this position significantly enhances lymphatic drainage, thereby empowering the body to eliminate toxins with greater efficiency during sleep, a critical physiological process directly correlated with superior memory function and overall brain health. Dr. Collins frequently reminds her patients, sleep isn't merely a period of rest, it is an active phase of recovery, and your body heals most effectively when it is properly supported, not subjected to strain. The 45-degree side recline, while appearing straightforward, represents a nightly act of profound self-preservation for seniors, safeguarding the heart, soothing the spine, and ultimately extending the precious gift of independence. Ultimately, sleep transcends mere physical rest. It is a profound process of renewal. As we progress into our senior years, each night of sleep evolves beyond a simple pause in activity, transforming into an essential form of deep healing, fundamentally determining the quality with which we engage with life itself upon waking. For older adults, selecting the correct sleeping position is not merely about achieving fleeting comfort. It is a critical investment in protecting the vital organs of the heart, nurturing the intricate complexities of the brain, and steadfastly preserving one's cherished independence for many years to come. The truth, though deceptively simple, wields immense power. Your body inherently registers and responds to your position throughout the night. When positioned incorrectly, it quietly accumulates pain, stiffness, and insidious fatigue. Conversely, when you align your body thoughtfully, ensuring it is adequately supported, gently elevated, and perfectly balanced. Your intrinsic healing mechanisms are activated, allowing your body to repair itself naturally and efficiently. Muscles relax into a state of deep repose, joints release their accumulated tension, your heart rhythm steadies and beats with greater ease, and your mind awakens with unparalleled sharpness and clarity. Medical professionals universally concur that even seemingly minor adjustments, the strategic placement of a pillow beneath your knees, the introduction of a subtle incline, or a conscious shift to your left side, can collectively lead to a dramatic reduction in aches, facilitate deeper, more restorative rest, and ultimately contribute to a longer, more vibrant life. Therefore, tonight, do not merely retire to bed. Instead, intentionally cultivate your sanctuary. Allow your body the profound opportunity to rediscover its innate healing rhythm. For when you bestow upon your body the gift of truly proper rest, it reciprocates with something immeasurably priceless, enduring strength, unwavering clarity, and the promise of yet another beautiful morning to live life to its fullest. Sleep profoundly, live vibrantly, and always remember that your most fulfilling years can indeed commence with the dawn of tomorrow's sunrise. These vital lessons are offered to inspire you to embrace life with authenticity and vigor.